Do you feel a nagging ache in your feet, ankles, or even your back after just a short walk? Are you worried about losing your balance and potentially falling because your feet just don't feel stable anymore? Many people over 50 feel this way, and while it might seem like a natural part of getting older, the truth is, one of the biggest culprits might be hiding in plain sight, right on your feet. Bad shoe choices aren't just uncomfortable, they can steal your freedom, your comfort, and even your safety in your golden years. Imagine walking tall, steady, and pain-free again. Imagine tackling your daily activities, hobbies, and outings without constantly thinking about your aching feet or the risk of a stumble. In this video, I'm going to reveal the 8 most dangerous types of footwear that could be secretly harming your health and stealing your independence as you age. I'll count them down one by one, showing you exactly why they're risky. But it's not all bad news. After we uncover the problems, I'll share 3 simple, life-changing footwear solutions that can help you regain stability, reduce pain, and put a confident spring back in your step. Stay with me to discover how to protect your feet and truly enjoy your golden years. I'm Dr. Rio Iba, a geriatric physician with 58 years of experience helping older adults around the world live healthier, happier, and more active lives. If you find this information helpful, please give this video a like and share your thoughts in the comments below. And don't forget to subscribe to the channel for more tips on healthy aging. My advice today comes from decades of clinical practice and is supported by findings from peer-reviewed studies in foot health and geriatrics. Research published in journals like the Journal of Foot and Ankle Research and Gait and Posture consistently shows the strong link between proper footwear and reduced fall risk and improved mobility in older adults. However, please remember this video is for educational purposes only. Everyone is different, and foot conditions can be complex. Always consult with your personal healthcare provider or a foot specialist before making any significant changes to your footwear or if you have ongoing foot pain or health concerns. They can provide advice tailored specifically to your needs. Alright, let's get right into the types of shoes that might be doing more harm than good. We're counting down the 8 deadly footwear choices, starting with number 8. Number 8. Worn-out sneakers or athletic shoes. You might think your old trusty sneakers are the safe choice for walking and daily activities. After all, they were comfortable once, right? But that's the trap. Sneakers, especially running or walking shoes, are designed with special cushioning and support that breaks down over time and with use. What was once a supportive, shock-absorbing friend can become a floppy, unstable hazard. The pain here is often subtle at first, maybe a little more tiredness in your feet, knees, or hips after a walk. This is because the worn-out cushioning isn't protecting your joints from the impact of walking. The arch support, if it had any, is gone, leading to your foot collapsing inward or outward, which misaligns your ankles, knees, and even your back. The tread on the bottom wears smooth, dramatically increasing your risk of slipping on wet leaves, smooth floors, or uneven pavement. Think about the sole of your favorite old walking shoes. Is the pattern still deep and grippy, or is it smooth in places? Are the sides stretched out? Can you twist the shoe easily like a wet rag? These are all signs of a worn-out shoe. A study in the British Journal of Sports Medicine highlighted how the shock absorption properties of running shoes decrease significantly after a certain amount of mileage, increasing load on the joints. While this study focused on runners, the principle applies to walking shoes and the joints of anyone using them, especially older adults whose joints may already be more vulnerable. The practical action here is simple but requires discipline. Regularly inspect your athletic shoes. Don't wait until they look completely destroyed. A general rule of thumb for walking shoes is to consider replacing them after about 300 to 500 miles of use, or if you wear them daily for walking, perhaps every 6 to 12 months, regardless of how the top looks. Press your thumb into the midsole, the thick part above the tread. If it feels hard and doesn't bounce back, the cushioning is gone. Check the tread for significant wear. The safety nuance is that replacing worn-out shoes isn't just about comfort, it's a critical fall prevention strategy. Falls are a major cause of injury and loss of independence for older adults. Good, grippy soles are essential. Don't hang on to shoes because they're comfortable in a broken-in way, they might be dangerously broken down. Keeping an eye on this one simple thing could save you from a painful fall. But what about shoes that weren't supportive to begin with? That brings us to our next item. Number 7, backless shoes like slippers and slides. Oh, the comfort. Slippers, mules, slides, anything you can just slide your foot into without a backstrap might feel wonderfully easy to wear around the house or for a quick trip to the mailbox. The pain here isn't usually sharp at first, but it's insidious. Because there's no back, your toes have to work extra hard to grip the shoe with every step to keep it from flying off. This can lead to strain in the toes, the arch of the foot, and even the calf muscles. More importantly, backless shoes offer zero ankle support. If you step on an uneven surface, a rug edge, a small toy, a crack in the pavement, your foot can easily slip sideways or twist, leading to a sprained ankle, or worse, a fall. Imagine trying to walk confidently downstairs in floppy slides. It's inherently unstable. Research presented at the American Geriatric Society annual meeting has repeatedly pointed to unstable indoor footwear, like backless slippers, as a significant risk factor for falls in the home. People tend to be less cautious inside their own homes, making unstable footwear even more dangerous. The practical action is to choose slippers and house shoes with a closed back and a non-slip sole. Look for ones that fit snugly but comfortably around the heel. For quick outdoor trips, consider keeping a pair of easy-on, supportive shoes near the door instead of just stepping out in your house slippers. The safety nuance is that while backless shoes feel easy, that very ease comes at the cost of stability. Your foot isn't secure, and it has to work unnaturally hard. This isn't just about preventing falls, the constant gripping action can also worsen conditions like hammertoes or plantar fasciitis over time. Don't sacrifice safety for convenience, especially when there are comfortable, closed-back options available. But if backless shoes are bad, what about shoes with no support at all? That leads us to number 6. Still watching? Type 1 in the comments below if you're finding this helpful so far. Number 6, flat, thin-soled shoes like ballet flats or some sandals. Ballet flats, minimalist sandals, and some fashionable loafers might look stylish or feel lightweight, but they often have one critical flaw for aging feet: almost no sole cushioning or arch support. The pain from these shoes comes from feeling every single bump and hard surface you walk on directly through your foot. There's no barrier, no shock absorption between your foot bones and the unforgiving ground. This constant pounding can lead to pain in the balls of your feet, metatarsalgia, heel pain, plantar fasciitis, and general foot fatigue. Without arch support, your foot arch collapses, stretching the tissues and putting strain on the ligaments and tendons. Think about walking barefoot on concrete versus walking on grass. Flat, thin shoes are like walking on concrete all the time. A study in the Journal of Bone and Joint Surgery, American volume, on the effects of footwear on foot mechanics showed that shoes with minimal support offer little protection against impact forces, which is especially important for joints that may have accumulated wear and tear over the years. The practical action is to examine the sole of your flat shoes. Is it thick enough to absorb impact? Can you feel the ground clearly when you step? Does the shoe bend easily in the middle instead of just at the ball of the foot? If so, they lack structure. Consider adding a supportive insole or orthotic insert to these shoes if possible, or better yet, opt for shoes that have built-in cushioning and arch support. When buying sandals, look for contoured footbeds rather than completely flat ones. The safety nuance is that beyond pain, the lack of support can contribute to foot deformities over time and alter your gait, how you walk, potentially affecting your balance. Your feet need protection and proper alignment. While adding insoles can help, it's often better to start with a shoe that has good foundational support. Speaking of support, what about shoes that offer the wrong kind of support? Vignette: I remember one patient, Mrs. Tanaka, a lively woman in her late 70s who loved gardening. She came to me complaining of severe knee pain that was making it hard for her to tend to her beloved roses. She assumed it was just arthritis getting worse. We discussed her activities, and she mentioned she wore the same pair of old, flat canvas slip-ons every day, both inside and out in the garden. They were easy to get on and off. On examining her feet, I noticed her arches were completely unsupported, and her ankles rolled inward. I explained how her unsupportive shoes were causing her foot structure to collapse, which was misaligning her ankles, then her knees, and finally putting excess strain on her knee joints. It wasn't just arthritis, her foundation was unstable. We worked together to find her some properly supportive gardening clogs and structured walking shoes for her daily activities. Within a few weeks, her knee pain had significantly reduced, and she was back happily tending her roses, amazed at the difference simply changing her shoes made. It was a powerful reminder that the health of your feet directly impacts the health of your entire body structure. Now, let's continue our countdown of footwear choices to be wary of. Number 5, shoes with high heels. This might seem obvious, but it's not just about stilettos. Even low or moderate heels can be problematic for older adults. The pain here is immediate and cumulative. Wearing heels shifts your body weight forward onto the balls of your feet and toes, creating unnatural pressure points. This can cause bunions, hammertoes, corns, and metatarsalgia. Heels also force your ankle into an unstable, pointed position, making you more prone to ankle sprains. Furthermore, wearing heels changes your posture, tilting your pelvis and putting strain on your lower back and knees. Even a small heel of 1 or 2 inches can significantly affect your balance by reducing your base of support and altering your center of gravity. A study published in the Journals of Gerontology, Series A, Biological Sciences and Medical Sciences found that older women who frequently wore high-heeled shoes had poorer balance and were at higher risk of falls compared to those who wore flat shoes. The practical action is to minimize or eliminate wearing shoes with heels. For special occasions where you feel you must wear a heel, choose a low, wide heel. A block heel is better than a stiletto, and wear them only for short periods. Carry comfortable, flat shoes to change into for walking or standing for extended times. Prioritize shoes with a wide, stable base and a heel height of an inch or less. The safety nuance is that while heels might seem glamorous, they are fundamentally unstable structures that work against your body's natural mechanics for balance and stability. The long-term effects on foot deformities and joint pain are well documented. Protecting your ability to walk safely is far more valuable than the perceived benefit of a few extra inches of height. So, if heels are out, what about shoes that are just too flexible? Number 4, excessively flexible shoes, shoes you can ball up. Remember those incredibly bendy minimalist shoes or some types of canvas sneakers that you can literally fold in half or ball up in your hand? While flexibility seems like a good thing, excessive flexibility means the shoe offers almost no structure or support for your foot. The pain comes from your foot having to do all the work that the shoe should be assisting with. Your foot contains many small bones, ligaments, and tendons that need support to function correctly, especially as they lose elasticity with age. When a shoe is too flexible, it doesn't control the natural motion of your foot. This can lead to the arch collapsing, pronation, or the foot rolling outward, supination, causing strain, fatigue, and pain throughout the foot and up the leg. A truly supportive shoe should only bend at the ball of the foot, where your foot naturally flexes when you walk. If you can twist a shoe like a dish rag or fold it in half from heel to toe, it lacks the necessary shank, the stiff part of the sole under the arch, and structure. The Journal of Foot and Ankle Research has published studies indicating that footwear providing adequate torsional rigidity, resistance to twisting, and forefoot flexion, bending only at the toes, is crucial for proper foot function and stability during gait. The practical action is the simple bend test. Pick up the shoe. Can you easily twist it from side to side? Can you fold the toe to the heel? If yes, it likely lacks sufficient structure. Look for shoes that have a firm sole that only bends easily where your toes meet the ball of your foot and resists twisting through the middle arch area. The safety nuance is that shoes that are too flexible don't guide your foot's motion. This lack of control increases the risk of missteps, ankle twists, and long-term structural problems in the foot, contributing to instability and potential falls. Proper footwear should complement, not hinder, your foot's natural biomechanics. But while flexible shoes are bad, what about shoes that are too stiff? Still watching? Type 1 in the comments below if you're finding this helpful so far. Number 3, rigid, unbending shoes, like some dress shoes or very stiff boots. At the other end of the spectrum from overly flexible shoes are those that are excessively stiff and rigid, often found in some traditional dress shoes or heavy-duty boots not designed for walking. The pain from these shoes comes from restricting your foot's natural movement. While a shoe should have some structure, your foot needs to be able to flex at the ball of the foot when you push off the ground. If the sole is too rigid and doesn't bend at all, it forces your foot to adapt unnaturally, leading to a clumsy gait, increased pressure on the heel and toes, and fatigue in the foot and calf muscles. Imagine trying to walk normally if your foot was in a stiff cast. A rigid shoe creates a similar, though less extreme, effect. This unnatural gait can also affect your balance and coordination. Research has shown that footwear that allows natural foot flexion improves walking efficiency and comfort. Conversely, overly stiff shoes can lead to discomfort and alter walking patterns. The practical action is the same bend test as before, but you're looking for the opposite problem. Does the shoe refuse to bend at all where your toes meet the ball of your foot? If it's completely rigid, it's likely too stiff for comfortable, safe walking. Look for shoes that have a firm sole with good support through the arch but a clear point of flexibility where your toes bend. The safety nuance here is that a natural roll off the toe is part of a stable gait cycle. If your shoe prevents this, it can make your steps shorter, choppier, and less balanced, increasing your risk of tripping or losing stability, especially on uneven ground. So, find that sweet spot, shoes that are supportive but allow for natural movement. Now, what about shoes that fit poorly? Number 2, ill-fitting shoes, too tight or too loose. This might seem obvious, but it's one of the most common and dangerous footwear mistakes. Shoes that are too tight cause pain by pinching nerves, restricting blood flow, and causing friction that leads to blisters, corns, calluses, and exacerbating conditions like bunions and hammertoes. Tight shoes cramp your toes together, affecting your balance. Shoes that are too loose are just as bad, if not worse, for stability. Your foot slides around inside the shoe, again requiring your toes to grip, similar to backless shoes. This lack of a secure fit means you don't have a stable connection to the ground, making slips and trips much more likely. If your heel slips out with every step, or your toes are hitting the front of the shoe, it's a recipe for disaster. A vast amount of podiatric and geriatric literature emphasizes the critical importance of properly fitting footwear for foot health, pain reduction, and fall prevention in older adults. Studies consistently show that ill-fitting shoes are strongly associated with foot pain and increased fall risk. The practical action is to get your feet measured regularly, as foot size and shape can change with age due to factors like ligament laxity and loss of fat padding. Measure both feet, as one is often slightly larger than the other. Try shoes on at the end of the day when your feet are slightly swollen. Wear the type of socks you normally wear with that shoe. Make sure there is about half an inch of space between your longest toe and the end of the shoe. Check that the ball of your foot fits snugly in the widest part of the shoe and that your heel doesn't slip excessively. Don't buy shoes hoping they will stretch out. The safety nuance is that proper fit isn't just about comfort, it's fundamental to stability and preventing foot problems that can severely limit your mobility. Investing in properly fitting shoes is one of the best investments you can make in your health and independence. And finally, the number 1 deadliest footwear choice. Number 1, high fashion or novelty shoes not designed for walking or support. This category is a catch-all for any shoe prioritizing extreme style or novelty over function, support, and safety, particularly for activities requiring standing or walking. This includes things like excessively narrow pointed-toe shoes that cramp the forefoot, shoes with slippery soles, platforms that are too high or unstable, or shoes made of stiff, unyielding materials that cause rubbing and pressure points. The pain is multifaceted: pinching, rubbing, instability, and fatigue from fighting against a shoe that isn't working with your foot. These shoes are often unstable platforms or constricting cages for your feet, significantly increasing the risk of trips, slips, sprains, and fractures. Your foot is forced into unnatural positions, impacting your entire body alignment and balance. While specific studies on novelty footwear in seniors are rare, the principles of biomechanics and gait stability apply universally. Any footwear that compromises a stable base of support, restricts natural foot motion, or creates pressure points is inherently risky, especially for those whose balance and foot resilience may already be reduced with age. The practical action is simple: critically assess the purpose of a shoe before wearing it for daily activities. Is it designed for walking, support, and stability, or is it purely for aesthetics? For everyday wear, prioritize shoes with a wide toe box, a stable, non-slip sole, good cushioning, and adequate support. Save purely fashionable shoes for occasions where you will be doing very little standing or walking, if at all, and always have a safe alternative available. The safety nuance is that chasing fleeting fashion trends can be detrimental to your long-term mobility and foot health. Your ability to move comfortably and safely is your most valuable asset in your golden years. Don't compromise it for a pair of shoes that are beautiful but dangerous. So, those are the 8 types of footwear that can steal your comfort, stability, and safety. But as I promised, there are powerful solutions. Here are 3 life-changing footwear strategies to help you walk better, feel better, and stay safer. Solution 1: prioritize features that promote stability and support. This isn't about finding one magic shoe, it's about understanding the key features that make any shoe suitable for healthy aging and making those features your priority when shopping. Think of this as building a checklist. First, look for a stable, wide base of support. The sole should be wider than the upper part of the shoe, especially around the heel and forefoot, providing a solid platform to stand on. Second, check the sole material and tread. It should be made of a non-slip material like rubber, with a good tread pattern that provides grip on various surfaces. Avoid smooth or slippery leather soles. Third, look for adequate cushioning in the midsole and heel. This absorbs shock and reduces impact on your joints. Press your thumb into the sole, it should have some give and bounce back. Fourth, check for good arch support. This can be built into the shoe's footbed or provided by a removable insole. When you look at the insole, does it have a contour that follows the curve of your arch, or is it flat? Good arch support helps maintain proper foot alignment. Fifth, examine the heel counter, the stiff cup at the back of the shoe that surrounds your heel. It should be firm and hold your heel securely in place, preventing it from slipping and providing ankle stability. You shouldn't be able to easily push it down. Sixth, ensure the shoe bends only at the ball of the foot and has resistance to twisting through the arch. This indicates proper structural support, the shank. Seventh, look for an upper material that is supportive but not constricting. Lace-up shoes or those with substantial hook and loop, Velcro, straps allow for adjustable fit, which is crucial as feet can swell during the day. Avoid uppers that are excessively stretchy or flimsy. Choosing shoes with these combined features creates a safe, supportive environment for your feet, distributing pressure evenly, absorbing shock, guiding your foot's motion, and significantly improving your balance and stability. This strategic approach to shoe selection empowers you to make informed choices that directly impact your safety and comfort every single day. It moves you away from choosing based on looks alone and towards choosing based on biomechanical benefits. This involves a slight shift in mindset when you go shoe shopping. Instead of asking, "Are these pretty?" or "Are these easy to slip on?" ask, "Are these stable? Do these support my arch? And, do these grip the ground well?" This simple shift in focus can make a world of difference in how your feet and body feel. Solution 2: ensure proper fit and consider customization if needed. As we discussed with deadly footwear choice number 2, proper fit is non-negotiable. This solution emphasizes the process of getting a good fit and recognizing when you might need extra help. Don't assume your shoe size is static. Your feet can change over time due to gravity, weight fluctuations, and age-related changes in tissues. Go to a reputable shoe store where trained staff can measure your feet, ideally using a Brannock device, the standard metal measuring tool. Have both the length and width measured. Try on shoes later in the day when your feet are naturally a bit larger. Always try on both shoes, as your feet are likely different sizes. Walk around the store to feel how the shoes perform. Do your heels slip? Do your toes feel cramped? Is there enough room at the front? Pay attention to any pinching, rubbing, or pressure points. If you have specific foot conditions like bunions, hammertoes, or flat feet, you may need shoes with extra depth, a wider toe box, or specific types of support. This is where considering customization or consulting a professional comes in. Over-the-counter insoles can sometimes improve the fit and support of otherwise suitable shoes, adding cushioning or arch support. However, if you have significant foot pain, deformities, or conditions, a podiatrist or orthotist can assess your specific needs and recommend custom-made orthotics, shoe inserts. Custom orthotics are specifically molded to your feet and designed to correct biomechanical issues, provide targeted support, and redistribute pressure more effectively than off-the-shelf options. While an investment, they can dramatically improve comfort, reduce pain, and enhance stability, often allowing you to wear a wider range of supportive footwear comfortably. The key here is proactive management of your foot health through proper fit. It's not just about avoiding shoes that feel bad, it's about actively seeking shoes that feel right because they are right for your foot structure and mechanics. This might mean trying on several pairs, even different sizes than you're used to. It might mean visiting a store specializing in comfort or therapeutic footwear. The effort is worth it for the long-term benefits of pain-free movement and reduced fall risk. Don't settle for shoes that are okay or that you hope will get better. Find shoes that fit well from the moment you try them on. Solution 3. Rotate your footwear and maintain foot hygiene. This solution focuses on caring for both your shoes and your feet to maximize the benefits of wearing supportive footwear. First, rotate your shoes. Don't wear the same pair every single day. Giving shoes a day or two to air out helps them dry completely, which is important for hygiene and helps the materials recover their shape and cushioning properties. Wearing the same shoes daily causes the cushioning to break down faster and can lead to foot odor and fungal infections. Having a few pairs of appropriate shoes for different activities, e.g., dedicated walking shoes, supportive house shoes, comfortable casual shoes, allows for rotation and ensures you have the right tool for the job. Second, pay attention to foot hygiene. Wash your feet daily with soap and water, and dry them thoroughly, especially between the toes, to prevent fungal infections like athlete's foot. Keep your toenails trimmed straight across to avoid ingrown toenails. Use a moisturizing cream if your skin is dry, but avoid applying it between the toes. Inspect your feet regularly for any cuts, blisters, redness, swelling, or changes in skin or nail appearance. If you have diabetes, daily foot checks are absolutely critical, as nerve damage can prevent you from feeling injuries that can become serious infections. Report any concerns to your healthcare provider promptly. Poor foot hygiene and unaddressed minor foot problems can lead to pain, discomfort, and changes in how you walk, potentially affecting your balance and making you less stable in your shoes, even if the shoes themselves are appropriate. A small, untreated blister or ingrown toenail can make wearing even the most comfortable shoe painful and alter your gait to avoid the pain, which in turn affects your stability. Maintaining healthy feet ensures that the supportive shoes you choose can do their job effectively. Think of your feet and your shoes as a team working together for your mobility and safety. Caring for both is essential for keeping that team performing at its best throughout your golden years. It's about creating a total environment of health and support for your feet, from the inside out. So, we've uncovered the 8 common footwear culprits that can hinder your health and stability, from worn-out sneakers and floppy slippers to rigid dress shoes and dangerous heels. And we've armed you with 3 powerful solutions: knowing what features to look for in a supportive shoe, insisting on proper fit and seeking professional help if needed, and practicing good footwear rotation and foot hygiene. By avoiding the pitfalls and adopting these solutions, you can dramatically reduce foot pain, improve your balance, boost your confidence, and significantly lower your risk of falls. Your feet are your foundation for independence. Treat them well, and they will carry you safely through your golden years. Which of the 8 footwear choices did you recognize in your own closet? Let me know in the comments below, and tell me which of the 3 solutions you plan to try first. And remember to subscribe for more ways to live your healthiest life. Next time, I'll be sharing simple exercises you can do at home to improve your balance and further protect yourself from falls. Thank you for joining me today. Taking care of your feet is a vital step towards maintaining your freedom and quality of life as you age. Making conscious choices about what you put on your feet every day can be one of the most impactful health decisions you make. It's not about sacrificing comfort or style entirely, but about finding that balance with safety and support. Look for shoes that hug your heel, support your arch, give your toes room to wiggle comfortably, have a sole that grips, and bends only where your foot naturally bends. Don't underestimate the power of good shoes. They are truly your partners in staying active and independent. Keep these tips in mind next time you're looking at your shoe rack or going shopping. Your feet will thank you, and you'll be investing in a future where you can move confidently and comfortably, enjoying every moment of your golden years without being held back by foot pain or the fear of falling. Walk tall, walk steady, and embrace the freedom that healthy feet provide. This journey of healthy aging is about empowering yourself with knowledge and taking simple, consistent steps. Choosing the right shoes is one of the easiest and most effective steps you can take today. Make the change, feel the difference, and step out with confidence.